Hello there, Pattaya. This is Dr. Ian at the Bangkok Hospital, Pattaya. Today we're going to talk about cardiothoracic surgery, and I have with me Dr. Sujit, who is a cardiothoracic surgeon. Welcome to the program, Dr. Sujit. Before we sort of go into the surgery side of it, how long does it take to become a cardiothoracic surgeon?
Well, after you graduate from medical school, you need another 5 years in training for residency.
Right.
And then if you want to become an independent, operate by your own, it may take another 10 years from that point.
So you can see
it's a long journey.
Yes, it is indeed. We're not talking about ordinary surgery here, we're talking about a highly specialized field. So what conditions do you see as a cardiothoracic surgeon?
Currently, in Thai people, we see a lot of heart condition like from ischemic heart disease, or we call coronary heart disease. They have the blockage of the artery to the heart, and then we can fix it by using the stent balloon in difficult case that the cardiologist could not do. So we can do the surgery called bypass surgery, that like making a new road to the heart.
In other words, open heart surgery.
But terms may be changed a little bit. 30 years ago, bypass surgery we do on a arrest heart or stop heart through the heart lung machine. But at the moment, we've been developing these techniques for, I think, since 1995, and I involved in the development in Thailand as well. So currently, we do bypass surgery on a beating heart. That means we don't stop the heart to do the bypass surgery.
This must be technically very difficult. If you can imagine, there's the heart, which is beating
all the time.
Dr. Sujit can go in and operate while the heart is still beating.
Exactly. We have some instruments that will help us to we call it a stabilizer. This is like a stabilizer. The heart is beating, so when you put the stabilizer on the surface of the heart, it will stabilize the location that we want to make the stitch.
Yes.
Moving very slowly or very little.
Restricting the movement.
Enough for us to do a delicate stitch. Because the stitch that we are using is like the size of the hair. So it's a small stitch, and the size of the artery that we do bypass is around 1.5 or 2 millimeters in diameter. That is small.
So this is actually sort of microsurgery that you're performing on a beating heart.
Yes.
You can see why it takes so many years to become a cardiothoracic surgeon.
You need training, you need experience, you need and you need to have very patient, because before someone will let you do a heart surgery by yourself, you've been through a lot before that.
How long does the usual, let's say,
heart
coronary
surgery
artery bypass grafting, how long does that take as a surgeon?
Currently, without the heart lung machine, so we can do it much faster. In my experience, I would say 3.5 hours for triple bypass.
That's still a long time to be standing there in the theatre. What other conditions would you called upon to do as a cardiothoracic surgeon?
The other second most common heart surgery here is a valvular heart disease, or people who have something wrong with the heart valve,
yes.
And we need to go in and fix or replacing the heart valve.
And you do this with a pig valve or a...
Oh, there are two kinds. The first kind is, like you said, pig valve, or we call bioprosthesis, made from tissue. They are pig valve, and they use the kind is called bovine pericardium. That means the heart sac of the cow to make a heart valve, and the other kind is called mechanical. That means it's totally mechanical. It's a metal with carbon leaflet. So that is the second to most popular heart valve.
It is necessary, it is comforting for you to know that we have doctors with the skills and experience of Dr. Sujit to be able to do this kind of procedure and this kind of surgery. This is Dr. Ian on behalf of the Bangkok Hospital Pattaya saying I hope to see you next time.